The World Health Organization says chronic obstructive pulmonary disease, or COPD, is the fourth leading cause of death worldwide.
So what are the signs and symptoms, and when should you see a doctor? Newswatch 16's Justin Gick gets the answers in this Healthwatch 16 report.
Healthwatch 16 is sponsored by UPMC, life-changing medicine.
November is Chronic Obstructive Pulmonary Disease, or COPD, Awareness Month. The American Lung Association says COPD affects more than 11 million adults and accounts for hundreds of thousands of emergency department visits and tens of billions in healthcare costs each year. Dr. Ganga Ranasuriya, a pulmonologist at UPMC in Williamsport, says COPD is treatable when detected early.
COPD is a broad umbrella term that includes chronic bronchitis and emphysema. In these conditions, the airways on the inside become narrowed due to the loss of elasticity in the airway wall that happens commonly with emphysema.
Dr. Ranasuriya says there is also increased mucus production and airway wall thickening, which makes it harder for people to breathe. As far as what symptoms patients should be looking out for that would indicate that they have COPD, Dr. Ranasuriya says they might first have shortness of breath that gradually progresses over time.
Several will have chronic cough that is just going on, on a daily basis. Many may attribute some of these symptoms to smoker's cough. Some may just consider the shortness of breath to getting old or being out of shape.
Dr. Ranasuriya says any degree of breathlessness is important to get evaluated, as there are other reasons such as cardiac causes that can also cause shortness of breath. She says many patients with COPD will tend to have frequent lung infections that pulmonologists call bronchitis episodes a few times a year.
We would need to diagnose it by doing breathing tests that we call pulmonary function tests. So at our office, my office assistant and nursing staff will make sure that all the tests that are required will be available and get scheduled with a physician provider to go over the diagnosis and the severity of the COPD.
To treat COPD, Dr. Ranasuriya says the main therapies is the use of inhalers. She says inhaled therapies go right into the lungs to help with all the symptoms of chronic cough, wheezing, shortness of breath, and improves patients' quality of life. Dr. Ranasuriya says there are some additional therapies that have been more recently available.
Several of these include bronchoscopic lung volume reduction therapies, such as Zephyr valves or endobronchial valves that can be placed within lungs that essentially allow the better, more healthier portions of lung to take over and improve their breathing and quality of life.
Dr. Ranasuriya says people should seek care with a specialist for lung and respiratory concerns when you're out of breath for a prolonged period of time. She says if you're also a 15 to 20-year smoker and you have the symptoms of cough and shortness of breath, you should be evaluated. Dr. Ranasuriya says if you find COPD earlier on, it's easier to treat and gives patients a better quality of life and a prolonged life as well. For this Healthwatch 16 report, I'm Justin Gick, Newswatch 16.